desire and her needs for purposes of moving forward with health care. And I'd like to have an opportunity to get her to speak. She's one of the people that really you need to hear from. Edith, where are you at? She looks just like this person. Here you go.
Hi. I probably do not even need a microphone because I am a rabid dog on this issue. I have been a social worker for over 25 years. I am well aware of problems in Medicaid and Medicare, and in 2001, not by my own choosing, have become an expert in the state of Indiana on private health insurance. Pat, will you help me hold this up? This is a picture on the far left of my daughter, Gabrielle. When she was 26 years old, she was a full-time kindergarten teacher for Fort Wayne Community Schools. She had the best insurance in the city. She was a champion athlete, tennis player, golfer, and swimmer, did not smoke, does not drink, and she thought she was having a sports injury on her ankle, limping around. Finally, we found out in surgery she had a very aggressive and severe case of rheumatoid arthritis. Boy, was I happy she had Anthem insurance. She was a year on medical leave where she could not walk. She was in a wheelchair. She had crutches. From the time of her first appointment with her orthopedic surgeon, December 5th, 2001, she had to wait for surgery to January 7th, 2001. We had to get a rheumatologist, and the first appointment available with the best insurance in the city was February 23rd of 2001, where he recommended a medication that took me and my attorney that I had to retain in order to get her the medication recommended by the IU Department of Rheumatology. That medicine cost $7,000 every 6 weeks. Finally, she was unable to teach full-time, so she transferred to a case manager full-time position. That job was cut to part-time last August, so she lost her insurance. We, the whole family together, are paying her COBRA. Randy is a private contractor, and so he has an individual plan that will not accept her. She was hospitalized in October in IU Med Center with histoplasmosis, which is a fungal infection of the lungs. She is now on medical leave again. Her COBRA expires January 2010. No one will insure her. She now has developed a new autoimmune disease called granular sarcoiditis, which appears to be calcifications covering the fungus that protect the fungus from the medication. Her generic medications are $3,000 a month. She is not disabled. She can work part-time. Don't we need kids to learn how to read in this country? No one will insure her. And so all you people wanting to keep your health insurance, you're one disease away from being kicked to the curb.
Amen.
She is 32 years old and nobody wants her. So I asked her to come today, but I was fearful that she would defend herself too mightily. So her mother came instead. I was in Washington, D.C., the 29th and 30th lobbying, was in Richard Lugar's office for an hour. I was in all the Blue Dogs' office, and most people are very sympathetic to this kind of a case. The answer to this is H.R. 676, which is the only bill that guarantees everyone health care. Affordable, accessible, portable, and equitable. The only bill. It is going to come to the House floor in September. I met with John Conyers for a half an hour, and it is coming forward. Physicians around the country are mobilizing. The IU study by Dr. Aaron Carroll of December 2007, and this study was done of AMA members, 59% of physicians favor national health insurance because they are sick and tired of dealing with insurance companies practicing medicine without a license. What do we need? Health care! When do we want it? Now! What do we want? Health care! When do we want it? Now! Thank you!
HR 676! HR 676! HR 676! HR 676! HR 676!